All right, next topic, pilonidal disease. Do we have any good options? Same disclosures as before. Pilonidal disease is really a disease of the young, and we see it either as acute forms or as chronic forms. It's not super frequent, but it's seen obviously in a good number of cases, 26 per 100,000 individuals, about 70,000 per year in the US. Again, typically below the age of 45. If you have a patient above 45, you should question the diagnosis. The pathogenesis is uncertain, and I will not get into the detail of that, but we seem to see a little bit of an overlap of the disease with hidradenitis that we see sometimes in the same patients. What is more clear, however, is that the presentation or the symptoms from it are quite annoying. They're ranging from pain, drainage, they're cyclic in nature, and if we leave the disease untreated in place, there is a long-term risk of cancer formation. My typical patient looks like this, is young, active, busy, typical student, or have a new job, and they really have no time for this. So what do we really have to offer? We have non-surgical options. We can just remove the hair. We can inject sclerosing agents. If we have an acute abscess, then we should obviously drain it because it hurts and we need to let the pus out. There is the option of brushing out the pits. There is an excisional approach, midline, eccentric. There are primarily open excisions, and there are various forms of flaps. So important is that we know what disease we're at that particular time dealing with. If we just see an asymptomatic quiescent pilonidal disease, we probably should leave it alone. If we have an acute abscess, that's one thing. If we have recurrent acute pilonidal disease, so different separate episodes where the disease acts up and then is either drained or not drained and gets quiescent again, but you don't really see much activity in between. Or you have somebody who has a chronic sinus fistula that is visible there with palpable induration and some drainage. If you have, again, long-standing disease, there may be complications of the disease, including osteomyelitis or cancer formation. We should evaluate the various approaches for